Araba, Dan Williams dwi gyfeirydd y bwrdd y corff Llywodraeth Iechyd Cyhoeddus Bai Abertawe. Croeso cynnes i chi gyd i gyfarfod arbennig y bwrdd bore heddiw. Croeso mawr i'n gwesteion, Denise Chaffa a Ken Sutton o'r tîm adolygu annibynnol. Edwin Hughes a Claire Taylor o'r llais ac i aelodau'r cyhoedd. Diolch i chi am ymuno â hi heddiw. So good morning everyone, I'm Jan Williams, I'm the chair of the board, the governing body of Swansea Bay University Health Board. And I'd like to extend a very warm welcome to you all this morning for this special board meeting. A particular welcome to our guests, Denise Chaffa and Ken Sutton from the Independent Review team, Edwin Hughes and Claire Taylor from Llais, and two members of the public. And we do apologise for having our backs to them. So we are recording the meeting this morning, and whilst this is not a public meeting, we are going to take questions at the end of the meeting. And to give people the chance to think about any questions, just to confirm, we don't take questions about any individual member of staff or any individual patient, and we don't take questions about any ongoing matters of clinical negligence. So the board is the governing body of the organisation, as I said, is the highest level of decision making, and we do have a regular cycle of meetings. We meet every 2 months, but there are times when there are matters of such importance that we convene a special board meeting. And we're doing that today to receive the final report of the Independent Review of Maternity and Neonatal Services at Swansea Bay. The report contains information, and our discussions will contain information relating to having a baby. Some of the content may be distressing, particularly for individuals who've experienced pregnancy complications, infant loss, or related trauma. So please take care while reading the papers or watching the recording. And if you find the material upsetting anyway, there is support available for you, and the details are available on our website about organisations that can help you. And we do have support available today for anyone who needs to access it, even during the meeting or immediately afterwards. So we've convened a special meeting today, as I've said, to consider the independent review report. And we commissioned the report, as the board will remember, back in December 2023. And we commissioned it on the back of a critical report that we'd received from Healthcare Inspectorate Wales that was published in December 2023, and it was based on an unannounced visit to our maternity services in September 2023. We also commissioned it because of a number of serious concerns raised by women and families about their experiences. Now, as we previously acknowledged, the review took more time than we would have liked to get up and running and fully established. We've apologised for this before, but we do so again today. And shortly, we are going to hear from Denise Chaffa, the Oversight Panel Chair, and from Ken Sutton, the Engagement Lead. And it is important that we as a board hear directly from Denise and Ken, and we are grateful to you both for coming today to take us through your work, and indeed to everyone who's formed part of the Independent Review team during the last year. Now, the last 12 months have been challenging for everyone involved in the review process, and especially for those women and families who've been prepared to relive traumatic experiences and to share the details of the very poor care they received. Over 1,000 people did so as part of the review, and we are very grateful. Diolch yn fawr iawn. We also understand and respect fully the decision made by some families not to engage with the review. Your voice is as important to us as the voices of people who engaged in the independent review. And yesterday we took receipt of the family-led review. And we know that for those women and families as well, they will have relived traumatic experiences to come forward. And we thank everyone. As we only had the family-led review report yesterday, we are going to take the time to really work through the recommendations and to do justice to those recommendations that relate to Swansea Bay University Health Board. There are recommendations for national bodies, Health Inspectorate Wales, Health Education and Improvement Wales and Audit Wales. These will not be a matter for this board, and I am sure that Welsh Government will be liaising with those national bodies accordingly. We will be taking the time to do justice to the recommendations coming through from Swansea Bay University Health. We are conscious that this is Birth Trauma Awareness Week, and we do know that the association is supportive of publishing this week, and Denise will say more about their view on that. But of course, this is all about giving everyone who wants to the opportunity to come forward and tell us about their care. We want to hear from everyone who wants us to know anything about their experience, because we can then use it to inform our improvement journey. Now, this report, it makes for tough, very hard reading. And as a board, we apologise wholeheartedly and unreservedly for the failures that the board set out and for the ways in which we let women and families down. We are deeply sorry for the traumatic experiences that resulted. And we are so sorry as well for just not listening. We give you our word that we will do so conscientiously from now on, and we will work tirelessly to build on the improvement work that we've started so that we enable our maternity neonatal services to be the best that they can be for the population we serve. And all of us, I know, share that purpose and that ambition. So I'm going to turn to our formal agenda now. We just had one apology from a member of our board, Professor Keith Lloyd. And can I just ask board members, please, you will have already declared interest in our register, but is there anything in the subject matter today about which you want to declare a particular interest? So we will now move to our agenda then. And Denise and Ken, croeso mawr eto, very warm welcome again. Members of the board have had the report, but we are very conscious that not everyone in the room will have had the opportunity to read it. And what we're going to do in that respect is give people the opportunity to ask questions outside the meeting, and we'll be giving the details at the end. But we'd like to hand over to you to give us your presentation and to set out your findings and recommendations.
So thank you, Chair. Thank you very much for inviting us. I think a few things I want to just say to start with, just reiterating what the Chair has just said. This is a really difficult report, and I think one of the things that's really important is every single one of us are patients, or we have family members that are patients, and it's, you know, this can be quite a triggering report, I think, for people. So really, it's very important that people just take a little bit of time and take care when we're presenting this. And what's very, very important to us is that this is the voice of the families and their experience, and that we really understand that. I've been chair of this review for a year, almost exactly a year, from the beginning of July. And I'd just like to start with thanking particularly the families who have come forward and shared their stories with us, which, you know, is traumatic to be reliving those stories. But what my kind of absolute wish for this board is that those voices matter and that they're heard, and what they really want to see is change in action. And that is by far the most important message here. Can I just go to the next slide, please? I just want people to just remind themselves, everybody here may be impacted by this. If people are feeling distressed, as you've heard, there is support here in the room, but there are also a number of organisations that are here to provide support. We spoke this week to the Birth Trauma Association. It is actually their awareness week, and they are specifically this week focusing on the importance of equality. And we'll be talking a little bit more about that around some of the findings we've had from those groups. But, you know, we accept people might just want to take a bit of time, and, you know, so obviously just a lot of care when reading this report. Next slide, please. You've heard really the background to commissioning this report, and it is on the back of pretty serious concerns. We had the Health Inspectorate Wales report, the Embrace reports, which are very important that organisations look at Embrace data with deep curiosity and investigation to look into the background and the context of every single case, and that is really, really important. But also quite significant concerns being raised by families. So the review, as you know, was set up, and I would, if we just go to the next slide, just talk a little bit about the approach. The review has got 5 components. The voices of families. These views are reported in a pretty raw form, and we've allowed the information of the families to be presented unchanged for them to be able to just describe their experiences. We undertook clinical review of cases, and we'll talk more about that. We had a forensic look at the governance and culture of this organisation, and you'll see that detailed in a lot of detail further in the report. We looked at staffing, we looked at leadership. And one very important part of this report is the data, the context and the demographic data, which is incredibly important around population health, and something that we would really recommend. Whilst it is quite an in-depth read, that it's incredibly important as a board serving this population to have deep understanding of the population that you serve and some of the risks within those population. Next slide, please. So I'm going to start with the family engagement work, and sitting next to me is Ken Sutton, and Ken supported the work for the East Kent review, worked very closely with Bill Kirkup, but also did he can introduce himself. Why don't I let you introduce yourself?
You're doing a very good job of it. Thank you very much. It's a privilege to be here today and to have played a part through the oversight panel, leading, as you say, on engagement. My background is as a civil servant, but I was born and bred in Swansea, and it's a privilege for me to come back and to be able to use my experience, hopefully to help you going forward here, really. So some of you may know from my work on Hillsborough, latterly, as you say, these through the East Kent services report.
So, and obviously questions specifically around that, Ken will be able to respond to later. So the family engagement and outreach team, this is the methodology and the areas that they reached out to. We produced a video that went out to general practices and communities to talk about the review posters. There were meetings with the Sketty Mosque, the Swansea Mosque, the Gypsy Roma travelling communities, the Chinese and East Asian heritage communities of Swansea, the African Community Centre National Veterans Group, as well as we had self-referrals via our self-referral midwife. We looked at got some feedback from the employer, biggest employer, I think, in the region, DVLA, and also looking at the Alternative Voices Partnership and CLICE. I would really like to give credit to CLICE and the importance of their report as well, which was all part of the approach that we took. We just take the next slide, please. So a number of ranges, and being aware that sometimes for people, digital access isn't always possible. The team went into shopping centres, sat in shopping centres with a stand and spoke to people that have recently had babies as well. And there were a number of experiences that were fed in. And what we did from all of those comments that came from families is we used a software package, which is called NVivo, to put all of the comments in to pull out a thematic analysis. And so we wanted to make sure that we had spoken to a number of people and that the themes, we got the themes of what people were saying. And so that included putting the CLICE reports, which very important report from CLICE through that as well. Next slide, please. So the key findings from the family engagement, next slide, please, is whilst many women do report a mostly positive experience in pregnancy, the focus of this report in particular is focusing on those women who had a considerably poor experience, and some of them more than a poor experience. They experienced severe birth trauma. And whilst that many of these experiences were pre-2024, there are still experiences that are happening now and in last year. So it was incredibly important that we understand what those concerns are. And they mainly reported, I mean, particularly around communication and advice was a key theme. And you'll see in the report, this is illustrated in what they were talking about. Birth trauma and fear was a big element of their feedback. But this feeling of being ignored, not listened to, and a lack of compassion and feeling that they were not receiving a compassionate delivery of care. This also impacted on their informed decision making as well, so able to make truly informed decisions because they were not feeling listened to. And we also found there was quite some significant feedback about birth partners and being separated from birth partners, recognising that some of this timescale is the COVID period, but post-COVID it felt still that there was quite a rule-bound approach to partners being able to stay with their partners. In addition, when we spoke to some of our more seldom heard groups who reiterated many of these feedback, issues about language and translation were key. And whilst there are language lines, that isn't enough to make an informed decision and consent to treatment. And that was something that really came out in the meetings that the engagement team had. And also a lack of cultural sensitivity and awareness. But what we did find from many of the families that the team spoke to was they were sharing their stories and their feedback because they wanted to work with the health board to make the changes. And they were wanting to see change, and they were offering to work with, and particularly when we come on to the engagement work, how they can be more connected. And one of the things we learnt was that a large amount of these families that we speak to do not want to come to meetings. They don't want to be on forums, and we need to go to them. We need to go to where they are in their communities, and that to be approached in a very sensitive way. And so I think that's a real message for the health board going forward about the importance of really reaching out and hearing. Even though these are difficult messages to hear, this is what it feels like to be on the end of this service. Next slide, please. So what we have tried very hard to do through this report is work very closely with the senior leadership team and the health board and feed back what we're hearing, because that's been really important, that we don't want to wait till this is published before the health board makes changes, and some of the changes are in place. So some of the things are already been in place and improving. And we know there's been some new senior leadership positions and appointments made, and that really has begun to help with some of the changes, and some of the messages that you're hearing today from the chair are really, really important about acknowledgement of where families feel that they've been let down. The Director of Insight Communication and Engagement team, the work that they are trying to do with feedback from families, but much more to do. And the same for the Maternity Voices Partnership is, I was talking to the chair of the MVP, 4 days a month is not enough to do this, and the combining of resources, bringing people together and making sure that there's a comprehensive understanding and co-design and co-production with families about services going forward are really important. And we also highlighted that there was a risk of disproportionate assurance from those that are having a good experience and not hearing from those that are not. And, you know, every single person's experience is important. The public statements that have been made are really important. And we talk a lot about acknowledgement, apology, commitment to act. But of course, that's got to be followed with the action. What we don't want, and we hear sometimes, is we don't want the words, we want the actions to follow, and things have got to be changed. And it's been very much appreciated that the chair and chief executive have met with a small number of families, and we would highly recommend that continues at very senior level, that people feel that they can speak to senior people and that things will change. And so whilst that's really important, that needs to be backed up with, we heard what you said and we put this in place. So can we go to the next slide, please? The clinical review process was taken. There were 2 clinical teams that undertook the reviews. So they reviewed the cases from the Embrace cases where the concerns had been raised from the years that generated the reason for this report. We added, more recently, as you're aware, a review of obstetric admissions to the intensive care unit. And one of the features of this unit is the split site working. It was incredibly important to do those reviews, and that has identified some risks that need to be further mitigated. We will talk about that later. But the importance particularly of, again, hearing from the clinical kind of in-depth reviews that took place. Within the reviews, they have an additional quality assurance process built in as well to just check that they've reviewed those cases and they've met the standard. They are the same team that did the ComTAF reviews, people may be aware of, and then additional teams in intensive care unit ones. And what the team did during the time was fed back to the directorates on an ongoing, because if they found areas that needed to be actioned urgently, they worked with the teams to do that. Next slide, please. So for maternity, and this is a theme that has come out from every part of the review, the clinical review, the family review, and the governance review, overwhelmingly access to the maternity triage system has come out as a significant finding. So what triage is it's in the past, when people were traditionally, people would ring a senior midwife on the labour ward, and they might ring and say, either I'm in labour, or I think I'm in labour, or my baby's not moving, or I'm worried about something in my pregnancy, or I've had a bleed, and they'd speak to a very senior experienced midwife, and they would usually come into the labour ward. More recently, there's been a kind of move around antenatal assessment units, and now we have this system called maternity triage. The issue about triage is it's one of the highest risk areas, because obviously that's the first point of call for people to really go to concern. And our review found problems really with access to triage, which is fed back from the families, but also from the clinical findings is that it's really, really important that people speak to somebody senior, that they're invited in for an assessment and seen by a senior member of the team. And so that is a key recommendation, which we'll come back to. The induction of labour pathway needed to be strengthened. They picked up some issues around fetal monitoring and some communication and documentation issues within some of the clinical team reviews. One of the things, and we'll talk more about staffing, is there is quite a lot of, there have been a lot more staff appointed, but there's a disproportionate amount of more junior, less experienced staff which needs supervision. And I think that's a feature that we're seeing across the UK. But the really important thing is to mitigate that risk with senior oversight and development programmes. And for the intensive care cases, really important to have maternity input on the other site. And of course, when you're trying to staff a unit, that means your staff going over to another site, and we know there's a distance to go. But to make sure this very small number of women are getting obstetric care as well as critical care, and how we can enhance that better. Early warning scores are ways of which that people can detect in maternity if there's risk factors emerging. And we talked about outreach. If there's not an intensive care unit on the maternity site, how can that be enhanced with an enhanced outreach team on the Singleton site? They and both the clinical teams identified lack of rigour in the incident reviews and lack of family engagement and some lack of compassion in the letters that were sent to families, poor responses back to families and complaint responses. So they were very key points which I picked up further. Next slide, please. So some of the changes that have been made, there is this acronym called BSOTS, which means Birmingham Simpson Specific Obstetric Triage System. And that is something that was developed in Birmingham around a kind of almost like a protocol for the way you run your triage system. It's a traffic light system, so you will categorise priority, and there'll be certain categories which would say, well, you know, this person needs to come in and be seen within 15 minutes, and there'll be different categories. And that has been introduced, so that's a very positive change that's been made. Our view as a review team is that's not enough. There's much more that needs to be done. And some of the feedback from the families was the fact that they didn't get a compassionate phone call when they were speaking. They felt that they were disencouraged to come into the unit, and you know there's something around the quality of the calls, the monitoring of the family's experience coming in, but also really closely monitoring that whole service. And for us, that's a key thing for the board to have huge attention to, because and it's not unique to Swansea. It's if you look at most of the Care Quality Commission reports in England, triage is a big concern. And you know, it was in the Health Inspectorate Wales report as well, but that needs significant improvement and urgently in our view. The unit has secured funding to support and upgrade their fetal monitoring capability. There are guidelines, but some of the guidelines need updating, and there needs to be an oversight kind of all of the guidelines for the directorates. The thing we talk about is prompt training, which is the practical obstetric multi-professional training. I mean, that's a very good model that is available in Wales and people are participating in, and that's a kind of theory of, you know, people that work together, train together, they are able to respond in emergencies together. That has been running and people have been attending it, but again, we need to see more obstetric participation in that. And we've seen development programmes that have been rolled out for midwives across the units in enhancing skills and competencies. Next slide. So the leadership and staffing key findings, we found that, well, post the pandemic, for the reasons we've already talked about, there was a lot of very senior experienced staff that left. Again, that's not unique for here, but the consequence of that was that between 2021 and 2024, there were very low and inconsistent staffing levels, predominantly in the midwifery staff. So that impacts directly on the experience of people experiencing the service. We know that that is related, and insufficient staffing in turn means that you can't complete the reviews and you can't implement the actions because people are pulled to keep the service where we can direct staff, frontline staff are directed to that. There was weakness in the leadership, a lack of oversight of rosters and escalation of the concerns linked to that. And then in turn, that leads to lower compliance with mandatory training because people can't be released to go to training because they're covering low staffing levels. And here again, historic current concerns with the maternity triage system. So how you can see how this feeds through every part of review. And a lack of senior medical presence in the triage system. So once people come in needing to access senior medical advice. Next slide, please. The changes that have already been made, there has been significant increase in staffing levels, and particularly since the Health Inspectorate report. That has really led to being pretty close to the establishment that you would expect to see. However, that really doesn't begin to address the issues about covering triage, as we talked about. You know, that needs some senior level of experienced staff. The need to cover the second site, if you've got anybody on the second site that's pregnant, to have, you're having to release somebody to travel to another site. So again, the numbers are small, but they need to be there when people need to be there when they're needed. Postnatal care is something that came up a lot with the family feedback. Is some people would describe that there were enough staff when they were in labour, but when they got to postnatal care, that's where people need support, particularly the post-cesarean section. They need help with the baby feeding. That was a lot. Still, there are still areas for improvement. Significant improvements in the medical workforce, particularly in the neonatal workforce. Changes in leadership, I've already mentioned. There has been investment in training, and there's significant improvements in compliance with mandatory training. There is a high rate of reporting of clinical incidents, which is a sign of a positive culture, where people feel that they can speak up and report incidents. That's very positive. That does sometimes sound a bit counterintuitive. You think, well, that must mean they've got lots of harm incidents. What you really would be worried if your incident reporting is low. However, what needs to happen when you report an incident is the whole follow through and the learning and the thematic reviews of the incidents and the actions that need to follow. And it's not unusual to hear people say, well, I reported something, but then nothing happened. So that bit is really important. And there is a growing improvement feedback from the experience of student midwives and medical trainees. So that's some of the improvements that we made. Next slide. The governance findings. So the governance really is really the way the organisation, really from the board to the ward to the community, is governed. So what is the safety around the governance? Between 2021 and 2024, the review just found significant weaknesses in governance, particularly around risk management, insight, oversight, and it's all linked to the same point about where you've not got many frontline staff, you're diverting them, therefore you don't have the staff to do that. Now, often it's very difficult, particularly when organisations are, resource pressured, many are, to make sure that you have enough staff in the governance teams and, we talked about stakeholder, etc., because you're trying to just resource the front line. But if you don't do both, you're pulling the front line away to do the stuff that you could be getting done by, senior governance staff. So that is an area really that, again, we pick up is a resource issue, but it's also senior level experience and oversight. Debriefs are a significant issue, and that came back through the family feedback. And, for example, someone will say, well, you've got to apply to have a debrief and then you have to wait 6 months to have it. And so that is kind of a formulaic way of, compassionate response to families. That's improved, so there have been, there's a formal debrief service in place, but our view would be that needs to be everywhere. It's everyone's responsibility, every person that's caring for someone's responsibility in meeting the feedback from families and acting. So that and the complaints process was overwhelmingly the feedback from families was that is not working. Backlog, being timed out on complaints, the response of complaints, the lack of compassion in written responses. Incident investigations significantly need to improve. I mean, they are happening, but we need them to be far more in line with Embrace guidance and multidisciplinary panels, and there should be a trigger to make sure that on the more serious ones there is independence, members of panels sought, and overwhelmingly making sure that families are at the centre of incident investigations. This review found that many of the reviews, the voices were largely absent. Next slide, please. So again, we've worked to look at the changes that have already been made. We've again kind of referred to the new leadership. The complaint handling has moved to the chief nurse. I think that's very, very positive. The Health Board has been looking at Silver and Gold Command meetings and reporting directly to the Health Board on the action plans from the Health Inspectorate at Wales. I mean, that's very positive. We still think there's more depth to be done there, but I think that's really helpful. Perinatal committee's been established. That's going to be chaired by the chief nurse. They've developed a dashboard. We still think there's more to be done there, and it's really important around the outcome data being absolutely known, and confidence and curiosity around always seeking to explore and understand, and making sure that the family's feedback is incorporated in that. We know the debrief services in place and there's a family engagement midwife, but we still think there's more to be done there. And there has been improvement with family involvement in investigation processes, but that needs to be central to investigation processes. And I think that's incredibly important. If you listen to families, they were there through the whole journey, and their view and experience is essential. And we've mentioned about meeting with the families. Next slide, please. So we were looking at, what we're trying to do with this review is look forward. So what does this mean if you're about to have a baby here or you're having a baby tomorrow? What's currently in place? As we said, there are more staff recruited. Staffing levels are in line with expected standards, but with the caveats that we've mentioned, because there's absolutely more need for staff around triage and the postnatal care. Staff sickness rates are reducing, so that means that you have less reliance on temporary staff, and that means you've got more experienced staff, which is positive. In 2025, the majority of maternity and neonatal staff were up to date with the mandatory training needs. But there will always be more to do. And we've talked about the importance of prompt training, for example. The up-to-date analysis from Embrace isn't yet available, but the data, unadjusted data we've seen shows a gradual downward trend, which is positive. However, every one of those cases, no matter the number, is a patient and their family and their baby. So I would, one is too many if there was any possibility that was avoidable. And I think that's the way to address this, is to make sure that every single one of these cases is explored in a very compassionate way. The HIE rate, which is the hypoxic injury for neonates, that has reduced significantly in the last year, but again, detailed analysis is really important, and we would recommend independence, particularly for those cases. It's very, very important to look at investigations in a non-defensive way. You can always look at what you could do better and to take a focus of that way. There was reported positive relationships between maternity and medical staff and neonatal teams, and that's really positive to hear. And both that was at the on the ground and at senior leadership level, people work well together. And the review heard that the staff felt confident to raise concerns, which is very positive. Amongst that, there will always still be room for improvement. There will still always be examples of incivility, so that always needs to be addressed. Next slide, please. So I'm just going to come on to the recommendations, and what we've tried to do with the recommendations, and I've worked in maternity safety for many, many years, and one of the problems with maternity safety is organisations get inundated with hundreds of recommendations, competing recommendations, not prioritised. And I was in my last role, we did a piece of work which we called the R2I, which is the recommendations to implementation. So they have to be owned, timed, resourced, and happen, and accountability for that. So otherwise we can just recommend and things don't progress, and we have to be able to measure that. In the report, there are some more detailed recommendations for the maternity and neonatal teams, which are more in the clinical space, but these are the corporate recommendations of what we would say are the must-dos. So we can go to the next slide. Without exception, establishing a single point of access for maternity triage. Currently, if you're on a low birth pathway for a home birth or a midwifery-led unit delivery, the process is outside of the maternity triage system, and we think that's too high risk, and it needs to be brought into a single process. If someone's in labour, that's very easy to just signpost someone to the right place. But if they've got reduced fetal movements, they do need to be assessed, and that needs to be one process. That's just one example. There will be other reasons people call. We feel very strongly that there is national guidance about this, and to be compliant with that guidance, and we would expect the Health Board to have close oversight of that at their board meetings. There is importance around the delivery of consistent care with oversight for senior clinical staff across all services. So that is particularly around if there's an instrumental procedure on the labour ward, that is overseen by somebody who's senior and experienced. We talked about oversight, obstetric senior oversight on the other site in critical care, and the same for neonatal care. Maternity early warning systems, that has been introduced, but there's an all Wales approach to that. And actually the early warning scores are used on the Singleton site, but they need to be on the other site as well. So the reason that's so important is that sometimes a pregnant woman's blood pressure is much more significant if she's pregnant as a non-pregnant person. So being able to be close to what might trigger. So what happens with an early warning score is you might do a number of observations of a pregnant woman, and if the score was high, then you would get immediate senior medical input into that, and that's why it's important and triggers a response. The improvement of quality of investigations, I think I've said a lot about this. The Embrace advice on how to do this is really comprehensive, and particularly about the family involvement. There's a guidance available on this. We think that there must be a trigger for when you've had a very serious event to trigger that you bring in somebody that's independent. In England, you're probably aware there's the what for HSIB, which is the Health Safety Investigation Branch. They've got a part called MNSI. It's always a brief, sorry about the acronyms, the Maternity Safety National Investigations that they do. In Wales, you don't have that, but we think there are ways that that could be set up with some reciprocal arrangements with a health board, so that there is somebody that was not involved in that case that is sitting independently, and it could be resource neutral if you worked in that way. And equally, you know, even going over the border, somewhere like Bristol or something reciprocal with them. Next, we families, I think, as you've heard. Next slide. The delivery of compassionate and trauma-informed care. Now, it's something, you know, certainly I've dealt with a lot in my previous experiences. There's some amazing work done by the Harm Patients Alliance. I think they are fabulous. They've got some really good resources. That's been set up by families who've experienced trauma. And, you know, what is helpful, and, you know, a lot of what I talk about is putting your arms around families when these events have happened. And this other term that I use a lot is restorative justice. There's some very interesting work that's come out of New Zealand, but this institute in Cambridge, a colleague of mine, Jane O'Hara, they've just published in the BMJ last week the importance of what families want to see. And what they want to see is openness, transparency, arms around them, support, and commitment to act and accountability. So just a learning culture is something that needs to be in the heart of every single person that works in this organisation, and that will take a little bit of time. And of course, what's happening here is you've got, you know, a large amount of staff where, as you've heard, the care is described as good, but where it's not, you know, those are the areas for huge attention. And trauma-informed care. And just as an aside, having spoken to some of the team from the Birth Trauma Awareness, who are really raising concerns about the importance of understanding birth trauma, they offer training. So I was talking to them about what that might look like. You might want to access some of their training for your staff. Improvements in governance processes, you know, a complete review of governance processes would be our recommendation, and board reporting and what the board are looking at. So the board is very aware of what they really need to be worried about and how that works with your current committees and structures, and the terms of reference for all of those groups. We talked about attendance of maternity services. You know, the Educational Fetal Monitoring Programme is really important. There is some really important work coming out of England. I don't want to be sounding England-centric, but there's a couple of really good bits of practice there from this institute, the ABC programme, which is about avoiding brain injury, and some really helpful tools that have been developed. So looking far and wide about some of the things that can help you. They look more about the how rather than, you know, reminding, because a lot of what you see in a lot of reports just remind people about fetal monitoring. It's more about how you do that and how you help staff and empower them in that area. A robust process for booking and prioritising women undergoing induction of labour. We know that there's been national change, so the Royal College of Obgyn advice and recommendations about when induction of labour should happen, but that links to information for families, recognising capacity and information and prioritising those pregnancies. Next slide, please. I think it goes without saying the importance of revising policies and procedures. And then these are not in priority order, but they're all equally important, by the way. And the final one that we have here for the health board is the real need to completely take a clean piece of paper and look at the way that you engage and listen to women. And what is of great heart, we're taking heart from, is particularly the work that has been done with the mosques, is they've already invited chief executive to go to a meeting, I think it's on Fridays, not just to talk about maternity, but other services as well. And I think, you know, if you can get this right for maternity, then it starts to impact across other services. And going back to not over relying on surveys, but really speaking to people and hearing what they've got to say. And I think, you know, we have to give credit to those families that are making those offers, which I think is really appreciated. Next slide, please. So these are some more Wales-wide recommendations. So we feel that the putting things right guidance is not working for families. Maybe it's the guidance itself, the terminology needs to be reviewed, and I know that there is work going on about that, but also the implementation and the way families feel on the receiving end of some of these what feel like legalistic letters, and they're really wanting compassionate response. Talked about the harm patient pathway, the opportunity to do something across Wales. A really significant need around mental health support, and whether there could be an all Wales approach. Really seeing what more the Welsh Risk Corps can do. They're collecting in a lot of incident reporting, but thematic reviews and feeding back the learning. We picked up that there's a lack of clarity around the maternity and neonatal clinical network about their role, and that is something that needs some attention. A review generally of neonatal services, critical care services across Wales, and particularly around the extreme premature babies that we are beginning to see more of. Next slide, please. And obviously, healthcare providers and commissioners are with the way they look at and seek assurance on outcomes, and that is where the network can help. And actually, Embrace themselves can help. Embrace are always open to a phone call with them. You don't have to wait for the report at the end of each year. You can call them, you can get dynamic information from them, and they're incredibly helpful. We identified a shortage in paediatric radiology that's bigger than here, but it's Wales-wide, but it's also UK-wide, so there's some work to be done. Delays in post-mortem results, again, it's in pathology services, meaning families have to wait. And then our final point really is to think about whether some of the findings from this report may apply to other maternity units, and you'll be aware of the Wes Streeting kind of reports in England about maternity services in England. Next slide, please. So in terms of next steps, next slide, please. You know, this is our kind of overwhelming message, really. I kind of live and breathe by learning organisation principles. It's about we are hearing, and I think it's really positive to hear acknowledgement of what's gone on, not defensiveness, but acknowledgement. And we have not found defensiveness. I think that's been a very important thing to hear from the health board, that acknowledgement that things have not gone well and it needs to be improved, taking responsibility and a huge amount of work to rebuild trust, and that would be really, really important. The importance of family and staff engagement and compassion throughout, and you know, there's quite a lot of work and sources around promotion of civility and kindness. We think every contact should count. So you know, if I were a community midwife, I would want to know about a woman I was looking after, about how her labour went, whether she got any questions, taking the opportunity to go through or help or signpost her to get the answers or arrange a meeting with one of the senior clinicians. So at every level, so it doesn't move into a formalised process unless it needs to. We talked about meaningful apologies. It's always the right thing to do. Always the right thing to do is to apologise and support and commit to investigate and then come back. And sometimes families will need more than one conversation. They don't remember, particularly if their baby's born unexpectedly in a poor condition and goes off to a neonatal unit, they'll need more than one conversation because that's so overwhelming for them. A commitment around, we talked about cross-bond, a commitment to learn and impact and measure the change. So how will you know in a year's time that you've made the improvements? So thinking about some measurables. And I think there are a small number of examples in the report of comments that you would not ever want anyone to be making in your organisation. So think about what you do about when behaviour is unacceptable and people make, the kind of comments that someone makes to you, during childbirth, you remember for the rest of your lives. We were talking earlier actually about how one comment can completely drop the confidence in an organisation, and it's not okay, and it has to be dealt with, and there has to be ways of surfacing that and dealing with that. Next slide, please. This is the final slide. You'll be pleased to hear. So the Health Board has made a commitment that they're going to continue this conversation, and I think it's the journey that started but needs to be continued. We know and we acknowledge that not all families have wanted to participate in the review, but to feel that they still can. This review obviously is published, but actually we're going to leave the self-referral midwife in place and transfer a contract over to the Health Board so that people can still come forward when they've read this report and say, I wish they'd known about what happened to me. Or somebody might have said, well, actually, I felt that the response I got was not compassionate. Can I come back? And I think those are the messages. It's really important. The psychological support will remain open in the future. And the oversight panel will remain in place to receive the response to this review and monitor progress. We'll work closely with the Welsh Government as well. And again, specifically separate to the oversight panel, we'll work with and help the community communication engagement team really take forward the family engagement. So thank you for listening. I'm sorry, I know it's a very hard thing for families in particular to be hearing this. But what I'm hoping families will feel is that their voice has been heard. Changes are going to happen. So thank you very much.
Yeah. Talk about young hetero Denise, and as I said at the start, this was a really, really hard, tough read to read the report. But listening to your presentation, it brings it all back, just how tough this is and just how much we need to say sorry to all those women and families we let down so very badly as has come through your review. It does, however, give us the blueprint, as I've said, to become the best we can be. And we are so appreciative of the approach that you've taken throughout the review, which is about, let's take this learning, and we will have a learning conference in the autumn. Let's take it, let's improve, let's be the absolute best we can be. So I'm going to open it up there to ask if anyone has any questions or comments for Denise or Ken for the reworking of the family and engagement piece. Nicola, would you like to begin?
Thank you, Denise and Ken. Having had 3 very different birth experiences at the hospital myself, the last being in 2021, I found the report very triggering and such a difficult read. Having had a baby at the tail end of the pandemic, when you had to attend most appointments by yourself, it's a very lonely and isolating time. I completely empathise with the families who've had the courage to share their stories, and I'm so sorry for their pain. I attended a baby's funeral on Friday, where parents talked about their experiences of having to wear ear defenders asleep to drown out the noise of baby sleeping. So I welcome the suggestion of a dedicated bereavement suite, so both mum and dad can stay with the little one in a self-contained and soundproof room. Can we please ensure that we are liaising with affected families when we are looking at designing this, please? So I've just got 2 questions. I just want to know what we're doing to ensure continued support for affected families. And number 2, considering the context of this report, is there a plan in place to reassure expectant mums that issues raised are being monitored and working to be resolved in full?
Keith, would you like to make a comment first, and then I'm going to bring Liz in as our.
I mean, thank you for sharing that as well. It's really, you know, and we are so conscious about the risk. You know, I think the balance is having voices heard, but it is a very distressing read, and I'm sorry, you know, it is very difficult, but being able to hear it and to be able to share that. I completely agree with you about, I'm a big kind of advocate on co-production and co-design, genuine. I've worked with quite a lot of families over the years who often get brought in at the last minute, but bringing families in at the beginning to help them in a co-production about, you know, knowing that, you know, families are all different and they've got individual needs, but I agree with you about bereavement. But I think what, in my opinion, that families about to have babies here need to know is the sort of things that we are hearing from the health board is acknowledgement and commitment to act, and particularly some of those areas around triage, which is, I mean, that came out through every bit of the report as a really significant issue, that there will be some work. So when they ring in, they are going to get, you know, a compassionate and senior level of response.
Denise, we are going to come on to an item that Liz has a paper on around what our immediate and intermediate actions are. We're just going to take any comments around your presentation first, if that's okay. But I will ask Liz to come in response to Nicola's question.
Yeah, thanks, Nicola, and thank you for sharing that with us. From a bereavement room perspective, there are plans in place now, and Darren might want to come in and give a little bit more detail. It isn't in the best environment at all, and we have got a view to where else it could be and where we could soundproof and provide a better experience for bereaved parents. So that plan is underway. The second question you asked is around those in our services now, and when this has been published, which it has today, will they have questions? And we've been supporting our teams, Richard and I, last night with staff to talk about the conversations that we will have with those in our service now, both in neonates and in maternity. And we've got some support for our teams to be able to have conversation, to acknowledge, and then to give more detail, and to build the relationships with those that they're caring for now, so that they can have honest conversations about that.
And before I ask Anne-Louise or Rena to come in, Richard, would you just like to give the details of the helpline?
Yeah, so there's a helpline that's been specifically set up for those that might have concerns. So the telephone number is 01792 986 709, and there's a website as well, sbu.maternityinquiries@wales.nhs.uk. The helpline's open between 8:30 and 5 p.m. Monday to Friday, and it'll be widely publicised on the website as well. So those who want to access it can do so Monday to Friday between 8:30 and 5 p.m.
Thank you, Richard. Now, as I say, we're going to be publicising that widely for people. Anne-Louise, do you have a question for Denise or Ken?
It's a comment, but I do have a question too. The first is to say that I recognise all of the things that are written in the report, and it is, I feel, some personal responsibility as well for not having noticed or asked or been curious enough, for which I apologise to the families. But one of the things that comes out of the report as well is the positive things that staff have done here. And I worry enormously about the pressure on staff because they've worked under very difficult circumstances. We've let them down in not noticing as well. And I would like that acknowledged. The other thing is, I'm really worried, you talk about the putting things right and the shortcomings that has had with regard to responses to the families, and I recognise that. However, it is very time consuming and resource consuming, and you've mentioned that we have a disproportion of less qualified midwifery staff to more senior ones, and it needs senior input to deal with these incidents that as they arrive and as complaints. And that will put extra pressure on the senior staff. And I know that this health board has got some financial resource issues. And that worries me because how are we going to find those resources in order to put in place what is needed to support the families? It's not a virtuous circle, it's the opposite.
Well, I have a bit of a different view to that, is that I think if you talk to families, what they want, particularly I'm talking response to harm. So is a compassionate response, an arm around them and a support around the journey. And I don't think, all staff are responsible for doing that. And if you don't get this right, if you haven't got enough senior staff, what you do is you end up compounding that harm for that family, and then things move into formal processes and end up with really very hugely intensive, resource intensive processes. And I think, you hear that a lot. I know people are busy, but I think when you look at the amount of time it saves down the road, in terms of people, once you start to move down into some of these formal processes, you move into adversarial processes, and it doesn't need to be like that. What would I want if it were me or my daughter or whoever? I'd want somebody to commit. And I was afraid, I think even newly qualified midwives, if they start with a compassionate response, or if something is a bit more difficult for them to deal with and they ask for support of somebody senior, it's my expectation that people take responsibility of that. And yes, of course, down the line, something might require more resource, but I think it's almost a spend to save, isn't it, in terms of, get people equipped to be compassionate from the get-go, really.
If I can come back on that, I agree. I think the arm around is something that I know happens as well. But it's the more complex ones, the ones where there is really very serious harm, and the parents in particular need lots of support. And that takes a lot of time, and it takes away from the supervision of the junior staff. So there is a resource issue, and it is a concern to me.
One of the things to think about is some organisations have family liaison posts, or they have somebody dedicated, so that if something, severe harm has occurred, that they, you would say to a family, this has occurred, this is what we're going to do, this is the process, this is the number, I'm here, I'm going to ring you and keep up to date with you. So I think there are models of doing that. So, I do take your point, but equally, I suppose the point we're making is this is everyone's job.
You wanted to comment.
Thank you, Mr. Chair. Thank you for such a comprehensive and thorough report. I found it a very hard and difficult read too, especially the section about the family's experience. And obviously, it's not the service that I want to be part of in terms of a health board. So I just wanted to put that up front. In terms of the questions, I'm particularly concerned about this ward-to-board assurance and the level of assurance we as a board should be seeking, and how we ensure as a board that we get that patient voice and the family's voice into it. So in a way, I'd be very interested in any best practice examples you have from possibly elsewhere in England or whatever, of how that works, and in a sense, examples of the sort of reporting that is being done. So that was one thing. And the second thing, gosh, clearly coming through the report is that we have a high level of deprivation within Swansea Bay. In particular, obviously, often statistically for obviously not the reasons we want, but this is associated with things like low birth weight babies and stillbirths. And again, I'm wondering, is there more we should be doing as a health board up front, particularly with the population health type agenda in my mind, to actually influence the pregnancies of people in particular groups? And that does include ethnic minority groups, because I did note that there's again a statistical relationship with that. So I just wondered if you had any views on what more we should be doing at an earlier stage in that antenatal period to try and influence the more successful birthings of people from those kind of groups.
A two-part question, Denise. One around water board assurance, and then this whole question of doing the maximum we can do in terms of the levels of deprivation in our community.
So in answer to your first question, one of the key recommendations that came out of the East Kent review, Bill Kirkhoff led, and colleague Ken was part of, and in fact, Edley Murdoch, who was on the oversight panel, she's a neonatologist, has been leading on this work called Reading the Signals. And that is specifically focused on what boards should be cited on and what they should be looking, what we call critical safety factors. What is it we need to be looking at? There are a number of things in England, for example, the maternity incentive scheme that requires board level reporting on some key indicators as well. And your nurses come from, I think, Portsmouth. You were very familiar with that. And I've been sharing examples of those kind of board reports as we've gone along. So I think there's a mechanistic way of doing it. So what are the things, and this comes back to your dashboard, your perinatal, but the difficulty with dashboards is the numbers will be small, but these are still, every one of these is a family. And so the family experience is going to be key. And that you already don't invite families along to talk to your board and talk about that. But I think for me, the other bit as a board is, and that's certainly been my experience of being a board member, is spending a bit of time together about what keeps you awake at night and what must you be really cited on. And I think we've given some signals of some of that. And that's been informed through Edley's work as well. I think Ken was
Just to add to that, I think, we've recommended a wider and deeper engagement plan, and where we can see that there's an appetite to do that. And I think that as a board, you will benefit from a more varied methodology for engaging with the families and communities around Swansea. We've been in relatively luxurious position, I suppose, and we've been able to invest in that activity in the last year in particular. And what we've found from that is that families and groups are very ready to contribute their experiences, but they are not going to do that through this kind of bureaucratic structure. So I think the future issues will come in part from what I would call, and we took this message from East Kent back to the Secretary of State for Health, more of a sounding board approach, so that you consult with families in their own terms, that you engage with groups where and when they feel comfortable in sharing that experience. And I think that will provide for the board in the future with more confidence that what you're hearing truly represents the experience of families and groups across Swansea. And I think the encouraging, you're not starting, by the way, that from scratch. And I would like to acknowledge the work that your DICE team already does, which is well led and has the right ambition to improve on what's in place. But we are finding that the individual families, but also groups and communities around Swansea are wanting to help. You know, they're not ignorant of the challenges facing the National Health Service, and they want to do what they can to help. And I think in the programme of work that we're recommending, I think that will also then result in the board having greater assurance that you're accurately hearing how services are improving and how that's felt.
So in answer to your second question, pregnancy is, you know, it's not even really 9 months, is it, of interaction. And so the really important data that I talked about that's in the report around population health, I think is bigger. I mean, I know you have wider services, so you have opportunities here in the health board that other maybe, you know, acute providers haven't got. You've got services that and your reach is bigger. I think there are some areas around particularly targeted actions around substance abuse, alcohol. You know, there are all kinds of things that other organisations have kind of got good examples of, reaching out to particular vulnerable groups. But you can't do this on your own. And, you know, it's a kind of public health kind of Wales problem in terms of how might you best approach some of this. So the range of that is wide reaching. And I think in terms of the maternity service, you have a contribution to make, because that comes back to if you do robust thematic reviews, then you've got a really good idea of what the contributing factors are to harm. And then you can do something and reach out to the services that might be able to help you. So that would be what I'd recommend.
We have remitted to our Population Health Committee, Denise, the whole section in your report on pornography, deprivation, etc., to make sure that we pick on and we pick up on that fully. Are there any more questions or comments for Ken at this stage? Denise and Ken, you're going to stay with us, and I'm very grateful for that. What I'm proposing that we do now is Liz will take us through the paper, the covering paper that we have. This really is the initial receipt of the report and immediate action. As we've already discussed this morning, there will be a very comprehensive improvement plan underpinning this. But we're going to take the paper, not move straight to the recommendations, however. Take the paper, take questions and answers. Then I'm going to ask Medwyn to come in on behalf of Llais. Then anybody else wants to comment before I'm going to come to Abby for closing remarks, and then we will move to the recommendation.
So please, can you hand over to you then?
Thank you, Chair, and thank you, Denise and Ken. I think that comprehensive overview of the recommendations, the recognition of work that's already underway and where we need to focus going forward is just briefly brought out in the covering paper from the report that we prepared. So we've picked up on the main recommendations and just kind of want to give you an update of where we are, but recognise, as the Chair said, there is so much more to do, and this is the start for us. Obviously, the acknowledgement up front of the impact this report and participation in the report has had on our women and families, and we're very, very grateful, as we've all recognised. And Ken, we really look forward to continuing work and engagement on a much broader spectrum across the community. But there were just a few things really to pick up on, particularly. You did mention that MEWS, the maternity early warning system, we have started to implement that this week, and it will go organisational wide. But clearly we have started within maternity, but there's a commitment to do that and to do that quickly. From the perspective of the triage system, you recognise that we've implemented VSOTs, but a lot more to do again, and we have plans underway to have a dedicated triage access point, one single point that will be resourced 24/7 by experienced and clearly trained midwives, and that we will have the medical cover to respond to the need of that triage once the individual woman comes to us. We have already implemented daily contact between ITU and maternity when necessary with clear MDTs at the time of need. But again, still more to do. The complaints and incidents you've talked about a lot, and our compassionate or lack of compassionate response to that is something significant for this health board. You've already established that complaints and incident reporting will come to me and will be in my portfolio, and that's absolutely where it should be. We have a lot to do, but again, we want to engage and listen to get that right. We have a process in Wales putting things right that is about to change, and that gives us a huge opportunity to have a much more first contact, understanding, etc., of incidents and complaints. We've already begun with any serious incident now to have an independent review of that, and we seek that outside of the organisation. I think the opportunity on an all Wales basis is one that we will explore, and when we have our learning event with the whole of Wales in November, which you're going to help us with, there's a lot that we can share and a lot that we can do together. Debriefs, you know, there's a plan, but again, more to do. And really, I think that any more than that, just giving you that update and answering any questions, that is where we are. But a huge thank you. Coming into a role, taking on no leave for maternity, which I am privileged to do, and being able to have a report that helps us to improve for the future. I'm really grateful for, so thank you.
Thank you, Liz. So I'll open it up now for any comments, questions, Liz, or wider. Nuria.
Thank you. Thank you very much for the report. It was a very difficult read, and it did trigger something in me in terms of my own care at the time. I think that it must be particularly difficult for families affected, and I want to acknowledge that. There are some clear and very important lessons for us all as an organisation, and for us independent members too, and I think we've heard that today. I really welcome your response, Liz, and I think one area I'd welcome more detail and assurance on is that area around compassionate and trauma-informed care. Our response is largely focused on staffing numbers, and that's important. And they are an aspect, but the report points to deeper issues of culture and behaviour we've just heard. So I'd welcome assurance that there is urgent work going on to establish what good looks like, to set expectations and to work on the barriers that may hamper us from meeting those expectations. I think that's really important. The other area I'd welcome more detail and assurance on is around how we're taking the systematic learning forwards, and that issue around from ward to board, which we've heard Rena comment on. I think that's really important. Many of the issues raised here in maternity that you found are reflective of weaknesses in our wider systems. And I think things like complaints, quality governance, service escalation, risk management, how we measure and report on quality versus very narrow performance measures that we've heard you talk about. These are all issues that we have been curious about as IMs. And it is the weaknesses in that system, in our controls, that we really need that scrutiny and constant response on. So I'll welcome assurance that this report will lead to strengthening and increasing in pace on improvements in our key governance controls across the health board, not just maternity.
Thank you, Nuria. Liz, I'm going to want you to come in first, then Tina, then I'm going to turn to Jean on quality and safety. But Liz, would you like to start?
Yes, thank you. And, you know, just listening to you, Denise, culture is massive part of this. It's good to hear that there have been improvements, but again, we still know there's more to do. And Tina, we've been looking at how we support development of a culture that is open, that is even more supportive of our staff, speaking out, and being able to listen and understand how to respond with care, compassion and kindness to those that we care for.
Pick up. So a piece of work that I've been looking at is culture heat map. We just want to make sure we've got some early indications or signs of where we've got poor cultures across the organisation. So I'm bringing together the soft metrics in the staff survey, but also hard metrics around turnover, sickness absence rates and so forth. So we've got the first version of that going to our Workforce and OD committee meeting next month. That will be an iterative process, but that does indicate where we need to put some extra support in. That will go down to quite a granular level within the organisations. We can actually see where we need to put some extra support in place. It's also for me about describing what type of leaders that we need in the organisation, so that compassionate, inclusive leadership with the right competencies, behaviours and confidence to tackle poor behaviour, etc. then when we need to. So we are working on the design of a leadership development programme which will run alongside this improvement plan. And it's also around the team development, it's around agreeing that set of principles and the way that we're going to work together. So we do call things out at an early stage and tackle them when they need to. So again, working alongside other exec colleagues on and making sure that's still at pace.
Thank you, Gina. And of course, we do remit to our Workforce and Organisational Development Committee this sort of the deep dive work and heavy lifting for us in respect of this agenda, and that Rena chairs that working alongside Tina. So Jean, may I turn to you then in terms of how the Quality and Safety Committee is being reset around this agenda?
Thank you, Jan. I would first like to say thank you so much for the report. I think various of my colleagues have already mentioned how disappointed we are that there could have been more that we did. And we are taking the opportunity to hold the mirror up to ourselves to make sure that we utilise the information that you've given to us. But more importantly, that we demonstrate the accountability that is incumbent upon us as or upon all of us as IMs to deliver. So thank you so much for that. And we do unreservedly apologise to our families. What we've in instruction from the chair and the CEO, we've taken the opportunity to reset the Quality and Safety Committee, to take a long, hard look at how we can best use scrutiny, but also in looking at that robust scrutiny, understand that we have clear visibility, and we've heard the term many times this morning, from ward to board. However, what Liz has brought with her, and we've had very short working together, but her help in redesigning the committee and redesigning the type of report we get has also ensured that we are inclusive of the reports coming back from what I call the shop floor, so that we're not merely receiving a report at committee level that gives us numbers, gives us no understanding what those numbers mean, no interpretation of how our staff are looking at those numbers, and importantly, what that translates to in terms of patient and staff care and quality, because that as a Quality and Safety Committee is our primary concern. So we're having meetings with all the senior executives. I will be going into meetings with Liz and the teams so that we can make sure we've hit every single tier of what we have in the health authority in terms of delivering quality and safety. More importantly, we want to design the reporting framework and governance between our committees that is simpler than we have currently, because it can be very complex to look at governance between those interrelationships. And we as a board will want to get better at making sure that interoperability is something that we can deliver more robustly than we've done in the past. So thank you for the information, and thank you to the families too.
No, I mean, I think that's really helpful, and you'll see, I mean, it's a pretty detailed part of the governance area, and I think that point you just made around this sort of myriad of committees and kind of really, that's I think really helpful. So if you were designing this today, when did you start? Because that's what you've got to really be excited on.
I'm going to ask Abby to add on the whole corporate governance piece, given its centrality, as you said.
Yeah, thank you both for the report. And it is really helpful. It will help us in our wide work. As Liz has referred to, we are working on a programme of work more broadly to look at our corporate governance framework and programme that we're calling Organising for Excellence, so that we have got much greater clarity from board to board and what needs to be reported at every level. What does the service need day to day to ensure that they're safe every day in terms of delivering the best possible service for our patients, right way through to at board level? What do we need to be receiving routinely? And we've talked about the risk that we hold data in different places, so it presents a silo. And actually what we've got to do is join that up, and what is it all telling us, not a little bit of it. And I think, Denise, your comment about the risk that we look at the data from things like our surveys, which may give a very positive position, but actually there's some really important information that we're missing. I know the report reflects the fact that we are developing the dashboard, the daily dashboard for the maternity service. So we're collecting data all in one place. It's very visible. It's very visible to us as an executive team. We've got more work to do on it, but having a central place that pulls all of those strands of information together, so we can really take the intelligence and insights from what it's telling us. And Denise, the phrase you used, that your colleague on the oversight panel about the insights, the signals from the data, that is so important to us. Knowing when there's a red flag that we need to be looking at and drilling into is a critical part of that.
So reading the signals. Yeah.
Reading the signals.
Just one, I think that's would be really helpful, but I think one of the things we found in the governance review is it's really helpful to hear what's going on with the workforce and organisational development, but then, and there is just avoiding the risk of something being in quality and clinical governance and something else being in workforce, because actually fundamental to this is your workforce, isn't it? Valuing your workforce and them delivering the best care they can. So I think just making sure they are doing it.
And I think, speaking to Jane's point then, we are going to take a cross-committee time to look at the themes, because it's, clinical, corporate information, it's all the different types of governance. They all need to come together, but we need to do it in a streamlined way, so that's the point for anyone. Are there any other comments or questions on Liz's covering?
Chair, if I may, just to say, Nuria, the last bit was, we must know what good looks like, and there are examples. Not everything will fit, not everything will be right for us, but what's important is we look at the best, the good examples out there, and we bring it back and work together with each of the committees to make it right for us. But the transparency, the insight, both ways from board to board is what's absolutely key. And there are good examples out there that we will go and.
Croeso mawr eto. Edwin, diolch am Seb o'r yma. So can we turn to you now for the views conference?
Thank you, Chair, and thank you for giving the opportunity to listen to the engagement. As you know, FAIS is not a regulator. It's independent of government, and it is independent of all parts of the NHS. We are there to listen and to engage with the voices of the people of Wales. And,
a little bit problem, so we can everyone can hear.
And can I also thank you for the report, for the rigour of the report. Can I also acknowledge the family-led review? I'm very much aware that so much pain has been articulated, has been heard over the years. And it was so important that that was noted and listened to. And what you have offered is a framing document, I would suggest, not only in the context of this board, but certainly in the context of wider deliberations that I'm sure ministers will wish to consider for improving the system across Wales. What I've also heard today, Chair, is in the context of your initial statement, an acknowledgement of pain, an acknowledgement that we got it terribly wrong over the years. And what the report reaffirms are systemic issues of failure across so many areas. And those are really painful. Imagine how painful they are for those families that went through those experiences. Imagine the pain that they suffered in the context of listening and reflecting on that. However, I've also seen a reflective engagement in the deliberations of the board. And for Llais, it's extremely important that we work with the families, to support the families, to make sure that the recommendations that have been structured not only in this review, but in other reviews that have been presented, are taken into account. You have acknowledged the pain. You have also identified the context of framing document that will take this forward. And that is based about improving compassionate care and making sure that is seen throughout the organisation. What looking to the past is important, and acknowledging that the key issue for us in Llais is to make sure that we move from the aspirations of statements to the real delivery of clear outputs that are measured, that are made public, and where the public and those families are at the heart of those changes as well. For you know better than I do that this is not a one-time engagement. It is a reflective process that will go on and on and on. That is how you secure change. That is, you make sure that it is owned, not only by the professionals, but by the people of Wales. For Llais, we acknowledge and we want to work with you. We are here to support all of those that have been involved in this process. And it is a fundamental right of anybody that gives birth here in Wales, that they do that in a safe, respectful and compassionate context of maternity care. That is key. Certainly I acknowledge and I pay tribute to the way that you were listening and engaging and starting on that journey. Llais is here to support as you take it forward.
Dr. Edwin, thank you so much, and thank you for the support and the offer to work with us now as we improve on our journey towards excellence, becoming an exemplar and doing the very best we can for the population. We deeply appreciate Llais being alongside us, and we welcomed, as you know, the Llais report, which the team weaved in to the wider independent review, and we are committed to using this as the opportunity to move towards excellence, and we are so grateful for your support. Anyone else want to make any final comments before I turn to Abby? Shall I do that then, to ask you to make some closing comments?
Yeah, I will, thank you. And I might repeat some of the comments and issues that we've picked up as part of the discussion so far. So I just want to acknowledge that today has been a very difficult but important day. Primarily, it's been a difficult day for those women and families who've experienced failings in our services. It's been a difficult day for staff colleagues in our maternity and neonatal services and for all of us around the table. As the chair said earlier, we are really grateful to the 1,000+ women who and their families who've shared their experiences with us in both your report and the family-led review and the Llais report. The power of the words from women themselves, it's really humbling and powerful to hear that, and that's really important, and our commitment to continue to do that listening and hear those voices is really important. I'd like to reiterate my apology, Jan, to women and families who've experienced failings, some of who've had really traumatic experience and life-changing outcomes as a result of things we could and should have done differently at the time and afterwards. And we're so very sorry for this.
I think we're all finding it a really moving experience this morning, so we take it.
Really grateful to you both for the way that you presented the report today, and really grateful to the members of your panel. They have done the work diligently, they've engaged with us, they've been thoughtful. And Denise, I think you said something at the front of your presentation around the intention with which they've gone about the work and you have done has been about wanting to make sure we as an organisation can hear those voices and learn and really embed the improvement that you've shared with us as part of that journey. So as we know that the final report is really comprehensive and very conclusive, there is so much good quality information for us to build on. It's a really rich source, it's a reference point for us to move forward as we continue on the improvement journey. The level of analysis the team have undertaken, the piece around the population health improvement journey that we're on, that I know that we are picking up as part of that work, understanding our population and communities in a way that we haven't done, and hearing very much about their experiences is really key to the improvement work as we go forward. Thank you for acknowledging the work that we've done already. We are on a journey of improvement. I do not underestimate, and none of us do around this table, how much more we have to do as a team, and that we will work consistently and in a committed way to making sure we make those improvements. We all want to be delivering services that are kind, compassionate. Most of the staff are our patients, they're our community, they are the services we would all want ourselves for our family and our friends. And that's what we are committing to do. Today is all about the families and the detail of the report, but I did just want to make some reference to staff because, as you've reflected, I know and believe that every day our staff come to work to do the very best job they can for their patients. They come into work wanting to give compassionate care, but we've not always provided the environment for them to do so. And we need to work with the team. This is about working with them, building with them how we can find the right kind of environment so that they can do the very best they can every day. The other thing we'll do is make sure that we continue to support staff. Your comment, Anne-Marie, really much about how we ensure that staff moving forward from today, that we're listening to them too. We have got some really strong mechanisms, but we have more to do in that respect, and we will build on the things that we put in the mechanisms that we have in place already. And we will also engage with wider partners. I think, Mira, your comments about deprivation and yours too, Jean, we can't do that alone. That is about working together to look at poverty, the impact that has on women. It's really stark in here when it talks about we have more women delivering babies with us, perhaps than any other part of UK who are in the highest levels of deprivation. That is really stark, and that whole agenda around anti-poverty is the work that we need to do with some of our wider partners. And Medvin, thank you to Slice for the work that you'll do with us. Claire, I know that we haven't met yet, and I can't see you on the screen, but I know we're meeting shortly, so looking forward to working with you as we progress this work. As part of the next round of work, as Jan's mentioned, we'll be bringing back to the report in September a comprehensive update in terms of improvement programme that will be informed, Ken, by the work that you're doing with us. You've said something really powerful, which is we can't just invite people here and engage with us in the way that we want to. We have got to be going out there and listening, and that's what we will do. And thank you for your commitment to helping us do that. That will be a really important piece of work. It will help us more broadly because we are doing improvement work in terms of mental health services and many of our other services that we know are under pressure, and we're looking at how we can build that kind of engagement into the work as we go forward. And then the final thing I would like to say is that when things go wrong for families, it's also traumatic for our staff. So making sure that we're wrapping around day in, day out. When things do go wrong, that we're supporting women and families in the way that you've described, but we are also supporting with trauma-informed support to our staff every day when we need to do that, and put our arms around them in the way that we need to. So I'd just like to kind of reiterate my apology, unreserved apology and heartfelt apology to the women and families who've experienced poor care. We really acknowledge the bravery in coming forward and sharing their stories with us. I know, even people around the table today have shared their sense that it's difficult for them who've experienced our services too. And just to know those people who shared their voices, that they will be influencing how we improve services going forward. So whether they choose to participate going forward, or whether they feel they've contributed, or they still are yet to contribute and want to come forward still, those people, I want to give confidence that we will listen and we will reflect on their voices, and how we will reflect on what they've told us as we go forward as part of the review. And I would just like to say thank you. The report is so comprehensive. It gives us so much to build on, and is, I think, pretty important piece of work, not just for us, but across Wales and probably the UK. It's probably one of the most comprehensive reviews of its kind, and it is so rich in terms of its information for us. So thank you both very much.
I'll move to close the formal meeting now by reflecting again on process over the last year. It's been harrowing, it's been challenging, it's been very difficult. None so, more so than for the women and families, whether they've contributed through the independent review, whether through the family-led review, or whether they are still to contribute. We thank them for having the courage and being prepared to relive such traumatic experiences. And we give you our word as a board, we will not let you down again. And that is something we will absolutely stick to as we start on this journey to become an exemplar in maternity and neonatal services. So with that, can we move to the recommendation, please? So we are receiving and fully accepting the report, findings and recommendations. And we are formally putting on the record our unreserved and heartfelt apologies to all the women and families whose care has fallen far short of the standard they should have expected, and we are so sorry. Can I ask the board, can you take assurance from the initial actions set out in this paper? They are the very start of the process, but are we assured at the start we've made? And can we be assured, Denise has outlined the fact that members of the independent oversight panel will remain, she will remain as the chair, and Ken will remain separately to assist us with family engagement overall. We also will have a member from Welsh Government sitting alongside the oversight panel members as part of external scrutiny. And of course, we will be ensuring that our own internal scrutiny and governance is as it needs to be. Can we take that assurance? Thank you. And then Denise, we will finish by thanking again you, all the members of the independent review team. We've seen you and Ken more than the other members of the team, but we know just how much has gone into making this a comprehensive and rigorous report with which we can really start to make sure we never let people down again. Dr. Mbariani.
Thank you. Can I make one further comment? We are aware that during the course of the meeting, the Cabinet Secretary has published a statement in relation to escalation. So colleagues will be aware that's the framework with which our services are assessed and the escalation of the organisation is set out. We have been informed that in relation to maternity and neonatal services, the Health Board has been escalated to a high level of escalation from enhanced monitoring into targeted intervention. Considering the breadth of the report and the further work we need to do, that doesn't come as a surprise to us as an organisation. And the timing of your continued support will work alongside that in terms of the enhanced oversight that the Welsh Government want to put in place to ensure that we're making progress in a timely way. So thank you, Helen. Thank you, Dan.
Thank you. And of course, we will be sharing that with our staff as well and explaining the rationale for doing that. It will be for the period of our improvement plan. So we will set about this plan with purpose to ensure that we come through it in as timely a way as we can, in as comprehensive a way as we need to do. So I'll close the formal meeting now, but as I said at the start, if there are any questions that anybody wants to ask, please do so. I did say at the start, there are things we can't comment on, questions we can't take. Sean, was there anything you wanted to ask?
Something I want to ask at this point in time.
Would you like to say something to us? Do you want to come and join us on the table to do that?
No,
Are you okay?
I am pleased for the families that there has now been an apology from the board, an unreserved apology, and that's something that we have been quite vocal about for quite some time, that we've been listened to finally, and that is what we wanted from the beginning, was to be listened to and to be believed. And I don't think that your predecessors did listen. I don't think that they did believe. But I am hopeful now that things will change.
Thank you, Sean. I know that will take, that will have taken a lot, given how difficult it would be for you and for and for all the families who've taken part with you in the campaign support group and in producing the family-led review. We are listening, we have listened, and we would go on listening and we would go on working with you. Please come and join us in the work from now on, John. We really want to hear your voice as we carry on from now. Please have a think about that. I know it's tough. Please take it away and have a think. But thank you, and thank you for your courage in coming today. We appreciate it.
Brought the meeting to a close now. Diolch yn fawr iawn i gyd, a mae'n cyfranniadau. Thank you all very much for your contribution.